Public health nurses use a proven method to help slow and stop the spread of disease. This process is called contact tracing. The health department gets a report of a confirmed case of coronavirus. Let's call him Case 1. He started feeling sick about 6 days ago. Other than a visit to his mom's house 10 days ago, he has been at home. Public health nurses take immediate action. They tell Case 1 to isolate himself at home in his own room and limit his contact with anyone else in the house. They remind him to cover his coughs, wash his hands regularly, and clean any items or surfaces he touches regularly. He should remain in isolation for about 7 days after his symptoms started and until he has not had a fever for at least 72 hours without medication. They tell Case 1's family who live with him to stay home in quarantine and watch for any symptoms to develop. These family members have been exposed to coronavirus by Case 1, but are not yet showing symptoms of infection. They should remain in quarantine for 14 days. If symptoms develop during that time, they should contact their healthcare provider or the health department. Public health nurses also talk to Case 1's mom since he visited her before he became ill. Nurses want to determine if she has been sick. If she is sick, they would isolate her at home in her own room and ask her who else she had been in contact with. Those contacts would then also be instructed to quarantine at home and monitor for symptoms. Case 1's wife has a business partner she works with outside of her home. The business partner was not in close contact with Case 1 and does not need to quarantine herself. She can continue regular social distancing practices until Case 1's wife begins to show symptoms. At that time, her contacts would move into quarantine. The whole community depends on people who are sick or exposed to work with the health department and follow public health nurses' instructions. By voluntarily staying home in isolation or in quarantine and monitoring their symptoms, they play an important role in stopping the coronavirus from spreading.